At this point, we have heard from literally thousands of women who have gone to their primary care doctors, their OBGYNs, sometimes even multiple different providers in search of relief from their hormonal symptoms, only to be told that their doctor can't do anything about it, that their symptoms are just a normal part of life and they have to live with it, or that they have depression or anxiety or some other mental illness that must be causing their symptoms. So why is it so incredibly hard for women in this country to find decent medical care for their menopausal and hormonal symptoms? Well, first of all, it starts with our medical education. In the US, the average primary care resident gets about 1 to 2 hours of dedicated menopause education out of their entire 3 to 4 years of residency. When I was in medical school 12, 13 years ago, any education we received about menopause was lumped into our endocrinology block. And it basically boiled down to women stop producing hormones around age 50, which causes osteoporosis, but hormone replacement is dangerous, so we're not going to talk much about that. And then throughout my OBGYN internship and family medicine residency, I don't remember having a single dedicated menopause lecture. It's simply not taught, and the attitude seems to be, well, every woman has to go through it and we can't do anything about it, so why waste our time? Yeah, it's infuriating, I know. So we've got a whole nation of doctors, nurse practitioners, and PAs who, despite being highly educated and respected medical providers, have received little to no menopause education. They genuinely don't know that anxiety, depression, brain fog, insomnia, all these things can all be symptoms of perimenopause. If we want to help women with these issues, we have to go and seek that specialized education out independently. And by the time most doctors are out of residency and settled into a practice, they're just too busy and overworked to get that done, even if they want to. The next big problem is misinformation. So many doctors are still clinging to the old WHI report from 2002. If you're not familiar with that, it was the report that claimed that hormone replacement is dangerous because it causes breast cancer. And that report is what terrified the whole world and just about shut down hormone replacement entirely. Many doctors are not aware that that study has been debunked time and time again by research teams all over the world over the past 20 plus years. They still believe that menopausal hormone replacement is going to cause breast cancer in their patients, despite the numerous studies we now have showing that, in fact, cancer rates and even mortality rates decrease with menopausal hormone replacement. And this leads into another problem in our medical system that's not really talked about much, which is the grinding slowness with which new information and new practices are adopted by the major medical societies. The truth is, most major medical societies are headed up by older physicians who might be somewhat stuck in their ways. They're slow to change, sometimes even in the face of overwhelming evidence. This reluctance to change established practices and guidelines trickles down to all the practicing providers on the ground and influences their decision making. Believe it or not, our medical training system is very hierarchical, a lot like the military. Medical students don't question the interns, interns don't question the residents, and the residents certainly don't question the attendings. And this follow the leader mindset doesn't wash out easily. So many doctors are extremely reluctant to challenge the established medical society guidelines. And then last but certainly not least, there's still a stigma that remains surrounding treatment of hormonal imbalances in menopause. There's a pervasive mindset that I've seen not only amongst medical providers, but even amongst patients themselves, that hormone decline and menopause are simply a natural part of life, and women should just shut up and deal with it. This is, of course, a ridiculous double standard. I mean, let a man have one embarrassing bedroom experience and you can bet he's going to be receiving a prescription for testosterone and Viagra by the next afternoon. But for some reason, women are expected to just tough it out, despite the fact that you spend a third or more of your life post-menopause. If you've ever caught yourself thinking, man, I just don't feel right, but this is just a part of life and I need to quit whining, stop right now. You deserve to live your life to the fullest. And if that means you need help with your declining hormones, then for goodness sake, go get it. All right, so that's easy for me to say, but how do you actually do that when we've already established that most doctors either can't or won't help you? This is where it might take some extra work on your part, unfortunately. You need to find a doctor who specializes in or is at least comfortable with bioidentical hormone replacement therapy. The easiest way to do it, regardless of where you are, is to ask your good friend Google for bioidentical hormone replacement near you. Unfortunately, in some cases, you may have to drive hours to find the nearest help, just like my sister-in-law did. But as knowledge of hormone replacement and women's health in general continues to grow, we're seeing more and more practices offering quality, appropriate hormone replacement therapy, and I really hope to see that trend continue. And if you happen to live in one of our covered states, we would be more than happy to take care of you from the convenience and comfort of your own home at New Leaf Online.